Bismillah ar-Rahman ar-Rahim. My name is Dr. Abdelhalim Asseem. I'm a consultant to gastroenterology and hepatology in Jeddah National Hospital. And today we're going to have a brief on celiac disease, and I will try to answer some of the frequently asked questions regarding this issue. Perhaps the first question is, what is celiac disease? Celiac disease is an immune-mediated disease that affecting mainly the small intestine. Usually it occurs due to ingestion of certain kinds of food which called gluten protein, which is present mainly in oats, wheats, and barley. And how common is the celiac disease? Celiac disease usually affects between 0.7 to 1.4% of the entire population, and it is more common in females to males with a percentage of 3 to 1. And the prevalence have been increased in the last decades due to improvement in the diagnostic tools. It also affects all the age groups. So maybe other question is, what is the cause of celiac disease? Until now, we don't know the exact cause of celiac disease and the true pathogenesis of the disease, but we have certain predisposing factors that may trigger the presence of celiac disease. One of the most common predisposing factors is the genetic, and because we found that in identical twins and in first-degree relatives, there is a higher incidence and prevalence of celiac disease. Other factors of predisposing factors including early exposure to infection like rotavirus, early exposure to drugs like certain kinds of antibiotics or immunomodulator drugs like interferon in the early childhood. So this all contribute to the occurrence of the celiac disease. Other question is, what is the clinical picture of celiac disease? We divide the clinical picture into gastrointestinal symptoms and non-gastrointestinal symptoms. The gastrointestinal symptoms, usually the patient comes with recurrent abdominal pain, with watery diarrhea, with abdominal bloating or gastric distension, and some manifestation of malabsorption. And then non-GI symptoms including anemia, for example, the patient may come with anemia, skin manifestation, and also perhaps the most common manifestation of skin disease is dermatitis herpetiformis, which like papules or vesicles that occurs in the extensor surface of the legs and knees. And the patient also come sometimes with bone disease like osteoporosis or arthralgias. So what is the diagnosis of celiac disease? Maybe this is the next question, and we usually rely on antibodies serology, and the most common antibody is the anti-tissue transglutaminase. We usually rely on genetic testing, and sometimes we perform upper endoscopies and take biopsies from the early part of the intestine like the duodenum. And so what is the treatment of celiac disease? The mainstay of treatment is gluten-free diet. You have to stop to take gluten with the food. And sometimes also we have like symptomatic treatment. For example, we treat the abdominal pain, we treat the diarrhea. Sometimes we treat the complications that happen due to vitamin deficiencies. But the mainstay still is the gluten-free diet. And one of the important treatment line is the preventive treatment, which is a screening of the first-degree relative. This is very important to screen the first-degree relatives in order to prevent the early occurrence of the celiac disease and prevent its complications. And last question is, which I ask it frequently, how we can get the gluten-free diet. So thanks to the Ministry of Health in 2018, they provide most of the gluten-free diet in all the public Saudi Kingdom hospitals. And also you can find it through the internet, through online sources, or you can find it in big supermarkets. So this is, as we said, as a brief, not everything about celiac disease. Thank you so much, and if you have any further question, please don't hesitate to contact me. Thank you.